Measuring thumb opposition. Patient will be in a seated position, elbow on table, hand in the air. The object of this measurement is to find the distance between the tips of the fingers and the tip of the thumb. So Rachel, if you could, touch all your fingers to your thumb for me. Very good. This would be seen as having no deficits. Now, Rachel, I want you to try that again, except pretend like you cannot touch the tip of your pinky to the tip of your thumb. Now, if you see this deficit, what you're going to do is you're going to grab your goniometer and you're going to measure this distance between these two fingers in millimeters or centimeters. Just whatever you do, make sure you're consistent. So I'm going to put right there, right here. And I'm looking at about 38 millimeters. And you want to do the same measurement for all of the fingers.